So if you know you can't stay active, then don't eat
Don't
too
eat.
much.
Come on, man. If you know you cannot exercise, don't eat. That's simple
Don't
as
eat
that,
at
because you
all.
eat
Not
to
to
work.
eat too much.
You eat to work hard on your muscles. So if you are not going to exercise, Gifty says, I didn't say. She says, don't eat.
When you eat, your glucose level increases. So when you exercise kind of, you are exercising the muscles, so your muscles are contracting and relaxing and contracting. So by doing so, it tends to absorb the glucose into your cells right away without needing a lot of insulin for it to be taken back into your cells. So exercise is very important in the sense that it absorbs the glucose from your bloodstream straight into your muscles because you are exercising. You are breaking down, you are using energy to exercise. So in so doing, you take all the glucose from your blood and into your cells without using much insulin.
In the past, we used to walk miles to hunt for food, when we were first made. But today, in our age, you are driving in a car, you're riding on a train or a bus. Nobody walks more than a mile to go for food. I'm pretty sure not even half mile. Nobody walks for food anymore. So this is where exercise becomes very important. So when you exercise, as she said, you are activating the muscles to work. And when they work, then they will be able to use the energy, which is the glucose. If you are not working those muscles, if you are not exercising, the energy that you take in the form of food is just lingering in your blood. And that is why most people are getting diabetic in these days. We have the same genes as before, but 30 years ago, if you check the statistics, diabetes is increasing more. But we are the same people. Why? Because our lifestyle has changed. No exercise, no walking, barely doing any physical activity. So the first thing, especially if you have a family history or the risk factors that she mentioned earlier, then you got to make sure that you consciously, exercise your muscles, consciously exercise in order to reduce the lingering blood glucose in your body.
So if you know you can't stay active, then don't eat too much.
Come on, man. If you know you cannot exercise, don't eat. That's simple
Don't
as
eat
that,
at
because you
all.
eat
Not
to work.
Eat too much.
You eat to work hard on your muscles. So if you are not going to exercise, Gifty says, I didn't say. She says, don't eat.
Don't eat too much.
Don't eat too much.
Don't eat too much.
Just taking a little bit, the least amount that will carry you on for the little things you do, like reading and doing your daily activities.
Lying down.
You don't need energy for that. 3 ways that exercise improve your insulin sensitivity. In other words, exercise makes your insulin more sensitive. So if you exercise, your muscles become more sensitive to your insulin. In other words, it will take just a little bit of insulin for your muscles to recognize that, oh, there's sugar in the blood. Let me pick that sugar up and use it. So the more exercise you do, the more your muscles learn to use less insulin. And so you may not be producing much insulin, or whatever, but because your muscles are trained with more exercise, regular exercises, they will learn to pick up the glucose even in the presence of a little bit of insulin. But if you don't have exercise, then the glucose will continue to pile up and your muscles do not use it as much. So exercise basically improves the sensitivity of your muscle cells to insulin. It makes your insulin more effective. It makes your insulin just efficient, I should say.
Yeah, and it's also, in another way of saying it lowers the resistance of the insulin. Type 2 diabetes is like, some people are able to produce the insulin all right, but it's become so resistant to the sugar that is available in your bloodstream. So it's not able to work on it as much as somebody who does not have diabetes. So if you're type 2, if you're diabetic, it's likely that the insulin that you are producing is resistant Okay, it doesn't work as well. In other words, it's not sensitive to the glucose uptake. So exercise makes your insulin more sensitive and less resistant. That is not just to control your weight or work your muscle or build up or be puffed up. It's make your insulin very sensitive and less resistant.
All right, all right, all right, all right. Now I'm just gonna throw in. Somebody may say, "But what is resistant?" I'm just gonna
Okay.
use an analogy here to explain insulin resistance. You know how we talk about antibiotic resistance? I'm going to use the same thing. So, in the presence of pronounced glucose, you have a lot of glucose. If you're eating a lot of sugary foods, a lot of carbohydrates, you're not exercising, and glucose is so much, your body is told to release insulin all the time because the glucose that is coming is so much, it cannot handle it. So, insulin, come out. You eat insulin. You every time insulin is coming out, and so it comes to a point that the body just gives up because they've seen insulin, and insulin is every time insulin. So it's now, what is this? I'm tired of insulin. In other words, kind of like antibiotic resistance. When you use antibiotics for every disease, antibiotic, every disease, antibiotic, every disease, antibiotic, then antibiotics don't work anymore. Why? Because your body has seen it all. All the bacteria knows the antibiotic. So when you have real need for antibiotics and you give antibiotics, they don't work. Same idea. And so if you are eating the starchy foods, you are drinking sugary drinks. If you missed our show last week, make sure you go back and check it out. Some of the foods you shouldn't be eating, and some of the drinks you shouldn't be drinking. You are pounding on them. You are eating them, and then there's no work, no exercise, no physical activity to use the glucose that you are introducing to your blood. Insulin gets tired. So for some people who have type 2 diabetes, if you watched our first show on this series of diabetes, we said some people produce normal insulin amounts and yet they are still diabetic. And the reason is that the insulin is not working. So what exercise do is that it improves your insulin sensitivity. It turns your insulin resistance around. Because now when you are exercising, your muscles are picking up the glucose and they actually find a use for it. They are changing the glucose to what we call ATP, the energy molecule, and using the energy molecule, getting glucose. Hey, this exercise, the muscle is contracting. Whatever exercise you're doing, they're pulling the glucose into your muscles, burn it up, and use it for energy, for contraction, like Gipti was describing. And so, with that going on, the body knows that, oh, okay, so if I release the insulin, the glucose is picked up, and that glucose is used during exercise or physical activity. And so then that glucose, that insulin is good. So it will release only when you need it. Now, whether or not you are diabetic, some people are diabetic, they are on medications, but they are not doing enough exercise. They think that because they are taking medications and probably insulin, they don't need enough exercise. If you add consistent exercise, some of which we are going to describe later on in this show, you are going to find that the insulin that you use may have to be cut back. The doctor may reduce the amount of insulin that you are injecting yourself. Why? Because now, for the first time, your regular exercise is making use of the glucose. And so, therefore, your body is not resistant to the insulin that you're using anymore. You don't need more to control it because your body has become an efficient user of insulin and of glucose.
So, on the other hand, if you are not exercising, you are injecting the insulin all right, but you realize that the doctor will keep increasing the units because it's not being
working right.
effective in your system because you are not exercising.
If you are exercising well, when you eat, the body finishes using the glucose that is needed. The rest are going to be converted into the bank, which is the glycogen, so that when you are fasting, we told you about intermittent fasting, when you are not eating and you need the energy, the body will release the glycogen back into the blood for what we call glucose, so that you can use it, and then your blood glucose level becomes stable all the time. Why? Because of exercise. So you store glucose when you don't need it, and you release it when you need it. So your blood glucose levels do not spike. It's just constant because of exercise. And the next thing we're going to talk about is the fact that exercise also helps with weight management. I know last time Gifty was careful to say that we don't exercise just because we want to lose weight. Some people, they don't want to exercise because the moment you think about exercise, they're like, but my weight is okay. I don't want to lose weight. Why should I exercise? And she actually proved the fact that you still got to exercise whether or not you are overweight or underweight. Exercise has nothing to do with just being, overweight or underweight. But then when it comes to blood sugar control, we employ exercise to lose weight, especially the weight that is around your belly. Where if your waist circumference is more than 40 or 40 for men,
35.
35 for women, then you are at increased risk. So you can lose some weight there, And with that, if you are exercising continuously and regularly, you may be able to shed some of the pounds around the waist. If your waist circumference is bigger, your sugars are high because you have insulin resistance. Because the fat there is preventing your insulin from working well, like we have already explained. So exercise will help you manage your weight and indirectly help you avoid high blood glucose.
Exercise, sometimes you may not lose the weight, okay, but at least you are able to manage your weight. So it's more like getting rid or making use of the excess sugar in your bloodstream.
If you eat, then you got to burn some of them out, especially if you have weight around your waist. Then, of course, especially as you get older, it happens because of all the processed foods that we eat, the sugary drinks, the juices, and all those things that
The salt.
the salt, everything is adding up to put some pounds around the belt.